day, everyone. My name is Matt Loiza. I'm the Dean of the College of Social and Behavioral Sciences. I want to welcome you to SBS Insights, a series of conversations with faculty where we showcase the unique research and work focused on public service and addressing social issues that's going on in the college today. So this afternoon, I'm joined by Dr. Saiful Islam, who is an assistant professor of sociology at Minnesota State University, Mankato. Dr. Islam is a medical sociologist who conducts research on health and healthcare-related issues from an organizational and political perspective. His particular interests include public policy, interest groups, state response to federal policies, and organizational change management. So welcome, Dr. Islam.
Thank you, Dean Loiza. This is a great opportunity for me to speak about my interest areas. I am very excited.
Well, just to say, before we jump into your research, which I know we've had the occasion to talk about on more than one occasion before, give everyone a sense of what you've been doing in your spare time, what little there is of it, I know.
As you can see my background, I have interest in music. I'm an amateur musician and a composer. I do fusion music, Western pop and Indian classical. I mix them. That's what I've been doing during whatever time I get.
So when you're composing in your studio and experimenting and everything, do you play it loud?
Yes.
All right.
I try to not to bother my neighbors. So I have an informal negotiation.
Well, good. That's good to hear. So tell us, as a sociologist, you describe yourself as a health policy researcher that focuses on change management. So just for the benefit of those of us that aren't sociologists, can you tell us in some just really basic terms what it means to conduct health policy research?
Basically, health policy research from sociological point of view could be defined as studying social interactions in the creation and development of laws, policies that take place through interactions between various groups that are involved in the healthcare field. I can try to explain it from like a regular, maybe a football field or soccer field where various parties, various groups work, some in competition with one another or in collaboration. So that's kind of my type of kind of health policy research that I've been engaged at. I look at various interest groups.
That sounds really interesting and also very important work. And I know that some of your past research has looked at disparities between urban and rural healthcare service. So could you give us maybe one example of the research that you've been doing recently and just how, from a student's perspective, just tell them how this work actually helps us change things for the better?
There are the total population in Minnesota is about 5.64 million, and 1/5 of that, 1.25 million live in rural areas. The disparities are high in terms of between rural and urban people, in terms of income, in terms of poverty level, especially in terms of health and healthcare. There are high uninsured or underinsured population in the rural areas of Minnesota. Their healthcare disparities. I can give you an example. The differentiation, There's difference in terms of having access to health, having access to healthcare providers or doctors, nurses. Telemedicine is increasingly has taken over healthcare facilities. Healthcare for the rural people, and there are lesser uh, access to mental health for rural people, and also still not a good developed end of life care system for rural care. So presently, I am working with CRPD to develop an EMS, emergency medical services, uh, to provide greater access to health for rural population in Minnesota.
I think some of your past research has looked at how federal policies get implemented at the state level, right? So I think if you just look probably at recent and current events, COVID vaccine distribution might be the biggest issue that falls along that line of research that you're doing, something that everyone I think knows about and is invested in. So I guess, based on your research, um, can you make any conclusions on how the state of Minnesota has done in handling vaccine distribution and how things either have gone well or could be improved with distributing it through, say, urban versus rural areas?
In terms of emphasizing the vaccine distribution, unfortunately, Minnesota has always been on a state that has been really cooperative in terms of having a successful vaccine drive. And the other issue that came out now is that a lot of the people in the communities are hesitant, sort of, or refusing to take the vaccine. Unfortunately, maybe due to lack of awareness, uh, or there could be other issues as well. And unfortunately, rural communities in Minnesota, there is this programmatic issue has risen, where I was looking at for my statistics class, I was looking at the vaccination data for Minnesota this morning, and from the Minnesota Department of Health, where also Minnesota Department of Health highlighted this issue that 40%, almost 40% of rural communities in Minnesota have not taken even the first shot of vaccination. So where in the urban metro Minneapolis, the rate is 56% compliance rate in terms of vaccination, whereas in the southwest and northwest part of rural Minnesota, the vaccination rate is only 16 to 17%.
I think in a general sense, it's probably safe to say that rural Minnesota is not served as well as urban Minnesota, probably in a variety of issues, but particularly healthcare, right?
Healthcare in terms of access.
So let me ask you this, since if you could arguably say that an effective vaccine policy would need to get buy-in from the broader population, how do you convince a population that has traditionally not been so well served by policy? And then, so how do you tell rural Minnesota then, or not even tell them, maybe that's part of the problem. How do you reach out to rural Minnesota and try to make a persuasive case that policy can work and can work for them? Does your research shed any light on how you can make that argument in a convincing way?
The most effective way is to organize these groups into kind of working together, organize goals and objectives around particular issues. One method is that I also propose this to Center for Rural Policy and Development to start working towards developing a consortium or an interorganizational level consortium where that combines all the all the nonprofits and community level groups that are working at different areas, especially in different counties of Minnesota, and bring them together through organizing conferences, seminars, and workshops, and so that they could go out to their communities and aware people. So I proposed a method called AAA, Awareness, Advocacy, and Action. I believe that through that would be a great way to have the communities buy in the need for vaccines for all the people within the community.
Okay, so Saiful, as a sociologist, you describe yourself as a health policy researcher that focuses on change management. And for our students or anyone else in the audience who may not know what change management is as a term, could you just fill us in basically on what that terminology means, on what you do?
Change management is a structured approach to implementing change. It started as a change in organization. Now, the change management techniques have been used to implement policy changes and policy reforms in the communities and society. And it is done through change agents. Change agents could be the state, federal governments. Change agents could be community groups, nonprofit organizations, charge-based organizations in the communities, and that help people to by making them aware on the benefits of changes and help them buy in the changes.
Well, that sounds great. And I'm looking forward to certainly learning more about the work that you're doing, how you're bringing students into it, and helping advocate for those changes and reforms that I think will benefit everyone in the state ultimately. Saiful, I really wanted to thank you for coming and joining us today and sharing a little bit about you, your research, and your hobbies. Definitely look forward to hearing some of your music in the future. For the audience, prospective students, if you're interested in learning more about Dr. Islam and his work, please visit us at sbs.mnsu.edu/sociology. And on our same SBS website, you can certainly look up more information on this faculty research series and how to view more episodes. And we thank you very much for your time and for joining us today.